Managing blood sugar isn't always easy, right? Whether you're living with diabetes or supporting someone who is, it can feel like a constant balancing act. But here's some good news. There are a handful of essential vitamins that can actually help make things smoother, boost your energy, and protect your health. Curious to know what they are? Let's jump right in and check out the top 5 vitamins every diabetic should be taking daily. Segment 1. Vitamin D. All right, let's kick things off with a vitamin that honestly doesn't get enough attention when it comes to blood sugar control. Vitamin D. Now, most people think of vitamin D as the bone health vitamin, right? But here's the thing. It plays a much bigger role in your body, especially if you're living with diabetes. Research shows that vitamin D can actually help improve how your body responds to insulin, which is crucial for keeping blood sugar levels steady. It also has powerful anti-inflammatory benefits. And since chronic inflammation is a hidden driver behind insulin resistance and many diabetes-related complications, getting enough vitamin D can make a noticeable difference in your overall health. What's tricky is, most of us aren't getting nearly enough. Even if you spend time outdoors, things like sunscreen, cloudy days, and living in northern climates can block your body's ability to make vitamin D from sunlight. That's why many health experts recommend taking a daily vitamin D supplement. A good starting dose is between 1,000 to 2,000 IU per day. But of course, it's smart to check with your doctor first, especially if you have other health conditions. So if you haven't been paying attention to your vitamin D levels, now's the perfect time to start. Your blood sugar, your immune system, and your heart will thank you. Segment 2, vitamin B12. Next up on our list, vitamin B12. And trust me, this one's especially important if you're managing diabetes. So here's why. Many people with diabetes, especially those taking metformin, one of the most common diabetes medications, are at risk of developing a vitamin B12 deficiency over time. That's because metformin can interfere with your body's ability to absorb B12 properly. Now, why does that matter? Well, vitamin B12 is essential for healthy nerve function, red blood cell production, and DNA repair. And if your levels drop too low, you could start experiencing things like numbness, tingling in your hands and feet, weakness, or even memory problems, which unfortunately are already concerns for people with diabetes. To stay on top of it, many experts recommend getting your B12 levels checked regularly, especially if you've been on metformin for a while. And if you're low, adding a daily vitamin B12 supplement, usually around 500 to 1,000 micrograms per day, can help correct those deficiencies and protect your nerve health. It's a simple fix, but one that can make a huge difference in how you feel and function every day. Segment 3, magnesium. Now let's talk about magnesium, a mineral that often flies under the radar, but is absolutely vital for people with diabetes. Why? Because magnesium plays a critical role in over 300 biochemical reactions in your body, including how your cells process insulin and control blood sugar. And here's the thing. Research has shown that people with diabetes tend to have lower magnesium levels than those without it. Low magnesium can worsen insulin resistance and make it harder for your body to manage blood sugar. It can also increase your risk for heart disease, high blood pressure, and nerve damage, all common complications of diabetes. The good news is increasing your magnesium intake can help improve insulin sensitivity and stabilize blood sugar levels over time. You'll find magnesium naturally in foods like almonds, spinach, pumpkin seeds, and avocado. But if your diet's falling short, a daily magnesium supplement, usually around 200 to 400 milligrams per day, can be a great way to cover your bases. Quick tip, look for forms like magnesium citrate or glycinate, which tend to absorb better and are gentler on your stomach compared to other types. It's a small addition to your routine, but it could make a big difference in how your body manages glucose and protects against long-term complications. Segment 4, vitamin C. All right, moving on to vitamin C. You might think of this vitamin just for immune support, but for people living with diabetes, it does so much more. Vitamin C is a powerful antioxidant that helps neutralize harmful free radicals in the body. Why does that matter? Because people with diabetes tend to have higher levels of oxidative stress, which can damage blood vessels, nerves, and vital organs over time. But here's where it gets interesting. Studies show that vitamin C can help lower fasting blood sugar levels and improve how your body uses insulin. It also helps reduce inflammation, a key issue for diabetics, and may even support heart health by protecting blood vessels from damage. And since people with diabetes often have lower levels of vitamin C due to increased oxidative stress, topping up your daily intake can make a noticeable difference. You can get vitamin C naturally from foods like oranges, strawberries, bell peppers, broccoli, and kiwi. But to truly see those blood sugar benefits, many experts recommend around 500 milligrams to 1,000 milligrams per day through a supplement, ideally split into 2 doses to improve absorption and minimize stomach upset. It's a simple, affordable, and effective addition to your diabetes management routine that not only supports your immune system, but also helps stabilize your blood sugar and protect your cells. Segment 5, Omega-3 fatty acids from fish oil. And finally, let's talk about omega-3 fatty acids, particularly from fish oil. This one might just be the unsung hero when it comes to managing diabetes. Omega-3s are essential fats your body can't produce on its own, and they play a crucial role in reducing inflammation, protecting your heart health, and even improving insulin sensitivity. Why is that important for diabetics? Well, people with diabetes have a higher risk of heart disease and stroke. In fact, heart complications are one of the leading causes of death among diabetics. Omega-3s help by lowering triglycerides, supporting healthy cholesterol levels, and keeping blood vessels flexible and strong. But that's not all. Research also suggests that omega-3s can help reduce blood pressure, ease joint pain from inflammation, and may even play a role in improving mood and cognitive function, which can sometimes be affected in people managing chronic conditions like diabetes. The best sources are fatty fish like salmon, mackerel, sardines, and tuna. But let's be honest, most of us don't eat enough of those every week. That's where a good quality fish oil supplement comes in handy. Aim for about 1,000 milligrams of combined EPA and DHA daily, but always check with your doctor for the right dosage for your specific needs. Pro tip, look for supplements that are molecularly distilled to remove heavy metals and other toxins, ensuring you're getting pure, safe omega-3s every time. It's a simple, powerful addition to your daily routine that supports your heart, your blood sugar, and your overall well-being. All right, quick recap before we wrap this up. Vitamin D boosts insulin sensitivity and helps calm inflammation. Vitamin B12 protects your nerves, especially crucial if you're taking metformin. Magnesium, key for steady blood sugar control and improving how your body uses insulin. Vitamin C fights oxidative stress and helps reduce post-meal blood sugar spikes. Omega-3s supports heart health and lowers inflammation, a must-have for diabetics. Now remember, before starting any new supplement, have a chat with your healthcare provider. These nutrients work best when combined with a healthy diet, regular movement, stress management, and good quality sleep. So, which of these are already part of your routine? Or is there one you're excited to try? Drop a comment down below and share it with me. I'd love to hear your thoughts. And hey, if you found this video helpful, don't forget to hit that like button, subscribe, and turn on the notification bell so you never miss out on simple, science-backed tips for managing diabetes and living well. Thanks for watching, and I'll see you in the next video.